Hello, everybody. I'd like to begin by asking you to please take out your mobile phones. Now, I know it's not a request that you'll be asked at the beginning of many talks. Normally, you're asked to put them away, but please don't be shy. Take them out and hold them up. There's quite a lot of rustling, but already I can see that virtually everyone in this room has a mobile phone. Now, in the palm of your hands is essentially a small personal supercomputer. Yes, even the oldest models have more number crunching power than the entire NASA mission that first put man on the moon. Today, I'm going to tell you about our research, which aims to harness the power of digital technologies to build a global early warning system to prevent deadly viruses from spreading around the world. So why is this needed? Well, infectious diseases rank among the gravest threats to human health, alongside global warming and terrorism. Tiny, invisible viruses and bacteria are always changing, always mutating, always evolving. They also have a remarkable ability to spread from one person to another to another. They can infect young and old, rich and poor, black and white. In fact, all races and all nations are susceptible. When it comes to infectious diseases, it's not them and us, it's us, we're in it together. Now, the recent Ebola outbreak in West Africa is a stark reminder of the challenge of containing a contagious disease in our increasingly interconnected world. It also highlights the vital role of public health and the urgent need for better public health systems. Now, while an individual doctor will do their very best to treat the patient there in front of them, they might be unaware of similar cases in other towns or in other parts of the country. That's the role of public health, and their mission is to protect populations. So we're talking about much larger numbers of people, and they look at patterns of disease. But the best way to prevent a disease from spreading is to detect it early at source. And that is why these incredibly brave men and women went to West Africa, to the source of the Ebola outbreak. They risked their own lives so that we, the world, could be protected from the risk of Ebola. But the sad reality is that many countries, developing countries, have little public health infrastructure. So Ebola went undetected for 3 months, smouldering. And when it was diagnosed, it was primed to explode. Now, while Ebola is terrible, an airborne virus is a much greater threat. In 1918, a new form of influenza spread around the world in tiny airborne droplets. It infected a third of the world's population, killing 50 million people. That's more people than World War I. Now, over the last century, we've seen tremendous advances in modern medicine and public health. They've brought us antibiotic wonder drugs, advanced diagnostic technologies shown in the lab here, and vaccines. And each of these advances has contributed to the tremendous gains in life expectancy that we've seen. But today in 2015, pandemic influenza remains at the very top of our government's risk register. It's not a case of if a new strain will emerge, but when. Because they emerge via a natural process. They're evolving. Now, the human consequences could be devastating. Estimates suggest that millions of people could die here in the UK. But it's the element of fear that can snowball a humanitarian, a social, an economic, and a global security crisis. When a pandemic emerges, normal life ceases to exist. People stop going to work. They stop going on buses and trains. They stop going to school. This means borders can close and essential services can fail. So the economic impact alone could put our banking crisis into perspective. Now, thankfully, pandemics occur relatively infrequently, but each and every day in doctors' offices across the country, our doctors are finding it increasingly difficult to treat bacterial infections that once were treatable due to antimicrobial resistance. And here you can see the drug pipeline has dried to a trickle. Sally Davies, our Chief Medical Officer, called this a ticking time bomb and highlighted the need not just for better antibiotics, but for better public health systems across the world to prevent these disease epidemics happening in the first place. Now, in all cases, early detection plays a crucial role, and we typically rely on accurate diagnostic tests because these inform the correct intervention. Should we give someone an antibiotic or should we isolate them? Now, here in the UK, we have one of the best public health systems in the world, and they rely on looking at diagnostic test results from those laboratories. But even there, we can see there are inherent delays between the exposure of a virus and receiving a confirmed diagnosis. So let's look more closely at what happens. So typically, if someone's exposed to an infection, there'll be an incubation period. They'll feel quite fine. Then symptoms will begin. There could be a sore throat, a cough, a fever. The person will typically still try and continue their normal life, going to visit their friends, going to work, going to school. Each time there's a risk that they could pass it on to someone around them. At some point, they start telling people that they're not feeling well and looking for information. And if they're really unwell, they'll visit a doctor or a hospital. And at this point, a sample's taken and it can be sent off to a diagnostic lab. There are further time delays, though, between waiting for the results to come, sending them back, a follow-up appointment, and it's only then that the correct interventions can be given. So we've got this time delay between exposure and diagnosis, and it leads to missed opportunities to give people the right treatment when they first turn up at their doctor. And often the wrong treatments are given, for example, antibiotics to treat a viral infection. But this time delay has serious consequences on public health efforts to prevent the spread of disease. There's typically 2 weeks between exposure and a diagnosis for flu, and in that time, a strain like a person could have jumped on a plane and traveled around the world. Remember, it took 3 months to diagnose Ebola. So there's an urgent need to turn back the clock and to try to pick up infections there and then when people visit their doctors or even at the onset of symptoms. And these compelling clinical needs inspired me to bring together a truly fantastic team of researchers to build a 21st century early warning system to prevent the spread of diseases. So we're harnessing the millions of symptoms that are reported on the web each day and linking these to a new generation of mobile phone connected tests. Our aim is to strengthen existing public health systems, so we're linking them to laboratory test data. But these methods could also bring a new generation of public health infrastructure to developing countries who don't have them at the moment. So the team is fantastic. We've got chemists, physicists, engineers, computer scientists, epidemiologists, medics, virologists, microbiologists from 5 UK universities, the NHS, Public Health England and industry, and we're all passionate about building better public health systems. We're taking advantage of the digital revolution. It's here, it's a reality. Today, there are 7 billion mobile phone subscriptions. That's more than the number of people on the planet. Some might argue they're spreading faster than viruses. But jokes aside, we're seeing incredibly high levels of use in developing countries. And in fact, they can be the single most advanced technology in some remote villages. Now, we've also seen half of the world's population is now online. So if everyone with a phone or a computer turned them on, it would be a digital map of the human race. And many of us don't leave home without them. Now, one of the first examples of the use of web technology to identify outbreaks goes back to 2003, when the ProMed internet reporting system showed this post. It's talking about an epidemic in China. And here you can see, have you heard of an epidemic in Guangzhou? An acquaintance of mine from a teacher's chat room lives there and reports that hospitals there have been closed and people are dying. That was the first public report of a disease that later became known to the world as SARS. It didn't come from a government. It didn't come from the World Health Organization. It came from an individual member of the public. and it shows the power of the individual to identify outbreaks. The official reports came several weeks later. But mobile phones have changed enormously since 2003. In fact, they've changed since 1973, when the first phone call was made, in the month that I was born. Every year, the components in our phone have got smaller. They've got faster, and it's become cheaper to send and receive information. In fact, I find it incredible that today, the smallest feature on your smartphone is smaller than a virus. And these technologies can be made at a price that's affordable to all of us. But this is changing the way we live. It's changing the way we work, and it's changing the way we learn. Now, this morning, many of you will have checked your phones within 15 minutes of waking up. During the day, you'll check it several tens, maybe hundreds of times. Some of you might be checking it during my TED talk. But now phones have overtaken fixed terminals as the main way we search for information. And indeed, 80% of us search online for information about our health. Now, Google have shown that you can take those search queries, anonymize and group them to detect outbreaks of flu-like illnesses 2 weeks before traditional public health efforts. This is their mapping system, which is available online for you all to see. And we're working with Google now to improve the modelling that underpins the analysis of this data and developing flu trends for the UK for the first time. We're also harnessing the power of social media. Each day, millions of people send tweets about their health. Now, not everyone who tweets about flu has flu. They're often tweeting about people around them. But we see more tweets about flu-like illnesses during flu season. And we can combine both search data and social media data to create a real-time mapping system to nowcast outbreaks across the UK as and when they occur. Now, we're applying this to flu, but it's a platform technology that can be extended to other disease areas. And we're beginning a project with an ethics project with members of the public to look at the wider issues of data privacy and data security in order to responsibly develop these technologies for public health. But symptoms aren't a diagnosis, and two diseases can share common symptoms. So accurate diagnostics remains the cornerstone of our early warning system. Now, our aim is to bring diagnostics out of those laboratories and to where they're needed, to people. So a doctor can give a test and result in a single visit, or even ordinary people like us can test in our own homes, or carers, parents, dads can test their loved ones. And this is part of a growing trend in the empowerment of patients. So it includes the use of home diabetes monitoring devices and wearable technologies such as the Apple Watch, where you can measure your own pulse rate. This is a project, a pilot study we've begun with Flu Survey, where thousands of people are sending us their symptoms of flu-like illnesses each week. And 700 have been sent self-swabbing kits to their home. When they have symptoms of flu-like illnesses, we ask them to take a cotton bud and to take a sample from their nose, pop it in this tube and send it back in the post to us. And we can analyse the results in the lab to see what viruses are circulating. And it's a great example of the use of the public to track outbreaks. But we can go one step further. And we're using the sensors that are crammed into the phones to give diagnosis there and then, and to connect the results into our early warning system. Here you can see an app that we're developing to read out commercial test results. Now, these tests work in much the same way as a pregnancy test, where you look for a line, and if the line is present, you have flu. Now, the human eye is very sensitive, but it can be quite difficult to read out these faint lines. So we're letting a smartphone camera do the hard work for us. And at the click of a button, an image can be analysed, stored, and sent into our early warning sensing system in real time with geographically linked information. But we can go one step further and make increasingly complicated tests that look at panels of biomarkers to search for different viruses. And here you can see an example where we've created a biobarcode. And in much the same way as a supermarket scanner scans your shopping, the barcode on your shopping, we can use a smartphone camera to analyze this barcode immediately. We're also working with industry partners, and here's an example of an all-electronic test where we've taken a tiny chip that's already found in your phone called a surface acoustic wave sensor, and we've tailored it to diagnose a virus, in this case, HIV. Now, if a finger prick of patient's blood contains the virus, it will generate an electronic signal on this chip, which can be sent to the phone via Bluetooth. Again, in all cases, we're harnessing the mobile computing power of phones and the ability to send and receive the data in real time with geographically linked information. But an early warning sensing system must be linked to a rapid follow-up response. So we're working with the NHS and international healthcare providers to create that link so that someone can get a follow-up appointment immediately, or can even be sent a prescription to their phone in some cases. One of the most exciting new developments is this collaboration with the Africa Centre for Health and Population Studies. It's located in Durban, in South Africa. It's one of the poorest parts of South Africa, and it's also the epicenter of the HIV pandemic. But even here, there are surprisingly high levels of mobile phone usage. They're not smartphones, but they're coming. And as the price continues to drop, we think we'll see that trend continue, and they'll be much more widely available. And in recent months, we've seen an unprecedented use of mobile technologies in the fight against Ebola. Text alerts are being used to get up-to-the-minute information to people in Ebola-affected areas. Mobile phones and tablets are being issued to healthcare workers to connect results from the field to central labs. Phone locations are being used to map potential outbreaks and contact tracing to identify those at potential risk of infection. To conclude, the world needs better public health systems so that next time a virus emerges, we're better prepared, and it will come. We're only just beginning to see the power of digital technologies, but it's clear they do show promise to help patients and populations, and it's their widespread use and low cost which could help to provide better public health systems across the world. Wouldn't it have been incredible if we could have detected Ebola 3 months earlier when it first emerged in those tiny villages? At the heart of this public health system, a digital public health system, is the public. That's you and you and you and me. So I urge you to get better informed about infectious diseases, share your data, and connect your results. And together, we can fight infectious diseases. Thank you.